Electronic health records have been widely adopted with the hope they would save time and improve the quality of patient care. But due to fragmented interfaces and tedious data entry procedures, physicians often spend more time navigating these systems than they do interacting with patients. Researchers at MIT and the Beth Israel Deaconess Medical Center are combining machine learning and human-computer interaction to create a better electronic health record (EHR). They developed MedNotes, a system that unifies the processes of looking up medical records and documenting patient information into a single interactive interface. Driven by artificial intelligence, this smart EHR automatically displays customized patient-specific medical records when a clinician needs them. MedNotes also provides autocomplete for clinical terms and auto-populates fields with patient information to help doctors work more efficiently. To design an EHR that would benefit doctors, the researchers had to think like doctors. They created a note-taking editor with a side panel that displays relevant information from the patient's medical history. That historical information appears in the form of cards that are focused on particular problems or concepts. For instance, if MedNotes identifies the clinical term diabetes in the text as a clinician types, the system automatically displays a diabetes card containing medications, lab values, and snippets from past records that are relevant to diabetes treatment. Most EHRs store historical information on separate pages and list medications or lab values alphabetically or chronologically, forcing the clinician to search through data to find the information they need. MedNotes only displays information relevant to the particular concept the clinician is writing about. Pieces of interactive text called chips serve as links to related cards. As a physician types a note, the autocomplete system recognizes clinical terms such as medications, lab values, or conditions and transforms them into chips. Each chip is displayed as a word or phrase that has been highlighted in a certain color depending on its category. Red for a medical condition, green for a medication, yellow for a procedure, etc. Through the use of autocomplete, structured data on the patient's conditions, symptoms, and medication usage is collected with no additional effort from the physician. After a year-long iterative design process, the researchers tested MedNotes by deploying the software in the emergency department at Beth Israel Deaconess Medical Center in Boston. They worked with an emergency physician and 4 hospital scribes who enter notes into the electronic health record. Deploying the software in an emergency department where doctors operate in a high-stress environment involved a delicate balancing act. The researchers plan to improve the machine learning algorithms that drive MedNotes so the system can more effectively highlight parts of the medical records that are most relevant. They also want to consider the needs of different medical users. The researchers designed MedNotes with an emergency department in mind, a setting where doctors are typically seeing patients for the first time. A primary care physician who knows their patients much better would likely have some different needs. In the longer term, the researchers envision creating an adaptive system that clinicians can contribute to. For example, perhaps a doctor realizes a certain cardiology term is missing from MedNotes and adds that information to a card. We should update the system for all users. The team is exploring commercialization as an avenue for further deployment.